there, my name is Mickey and I'm a registered massage therapist. Today I'm going to be showing you 5 different hip mobilization exercises. So first I'm going to be showing you a side-to-side mobilization. So what you're going to do is you're going to take your feet a little bit more than hip width apart, and we're going to try to focus on tilting our pelvic forward just to make sure that we are really engaging into the hip muscles. So what you're going to do is we're going to tilt from side to side. We're going to go back and forth. And we're not focusing on a stretch, we're focusing on warming up the muscles. So you're going to be doing this for a repetition of about 15 to 20 times. So now I'm going to be showing you what's called a hip circumduction movement. Now, this can be traditionally used in different types of martial arts as a hip opener. So what you're going to do is make sure if you don't feel like your balance is going to be right, you can always use a wall or a chair. So what you're going to do is you're going to try to make sure that your core is nice and contracted. You're lifting one hip up and back down to the ground. And then you switch to the other side and then back. So you're going to be doing this about 15 to 20 repetitions again, and that's in total, not just per side. And now I'm going to be showing you a leg swing. So for the first one, we're going to be doing a flexion and extension. And it is easier if you do have something to hold on to for this, because your balance might get thrown off a little bit while you do it. So what you're going to do is you're going to put one hand on the wall, you can put one hand on your hip or keep it free floating. So what you're going to do is just flexion and extension of the leg. Now you're going to be doing this one again for 15 to 20 repetitions. And then we're going to be doing adduction and abduction of the leg. So for this, I'm going to be showing you from a posterior point of view. So again, still holding onto the wall. Leg goes out and comes in front. Out and in front. And again, you're going to be doing this for 15 to 20 repetitions. And make sure that you do both sides of the body as well. So now I'm going to be showing you a deep squat. Now if you feel like you aren't going to be able to do this, then you can always refer to one of our other videos, which is a squat preparation video. And it'll help to make sure that your body is able to get into this position. So what we're going to do first is we're going to take our feet are going to be hip width apart. And as you squat down, make sure that your knees are staying behind your toe, and you're going to go down as far as you can. See, I can take all the way to the ground. So for me this is quite easy, but I know a lot of other people will have a hard time and they can only get to here. Some people even to here. So for me, I can go all the way down, and all you're going to do is hold. And it might be a little difficult to hold the first couple times. Even if you can make it 10 seconds, 15 seconds, that's fantastic. We really want to try to work our way up to at least 30 seconds to a minute doing this. Can be a little challenging, but it's definitely worth it. So now I'm going to be showing you a wall-facing squat. The first time doing this, it can feel a little bit awkward, but just try to get yourself used to it. Even if you can only hold the stretch for a couple of seconds, you're doing fantastic. And even if you can just get 1 to 2 reps in the first couple times, you're doing great. We're going to try to work ourselves up. We're going to hold the stretch down at the very bottom for at least 2-3 seconds, and we're going to try to get to 5 reps. So for this, you're going to need a wall, and you're going to go into basically a dancing pose. You're going to go into a plie. And you can always use your hands on the wall to make sure you have added support. And then you're going to go down and hold it down as low as you can for a count of 2. 1, 2. And then back up and down. So where you're really going to feel it is right deep into the glute. Very deep into the glutes. A little bit in your adductors as well, because you're also creating a little bit of a stretch. If you're having problems with your knees or your hips to begin with, I wouldn't recommend doing this.